practitioner, and they just got tired of treating people and not seeing them get well. And they went back and everything that functional medicine does, all MDs, all doctors had in school, but it's kind of like you forgot about that part, and then they just focused on a specialty of what they did. But there's a lot of doctors that are going back to this, and he's one of them. Another doctor is Diana Schwartzbein, who's a board-certified endocrinologist, and her story is that she got out of school and treating diabetics and just seeing that she couldn't cure anybody. And she started asking them to take their blood sugar, 6 times a day and watching it more, and she realized that the ones that were following the diet recommended by the American Diabetic Association weren't getting any better. And then she started altering their diet, taking out more carbohydrates and increasing protein, and their blood sugar started getting better. And she's part of the functional medicine movement also. But there's hundreds of doctors, across the nation that are moving in this direction. And functional medicine doesn't deal just with diabetes. They deal with everything. I mean, all kinds of diseases and disorders. But it's a philosophy. It's not necessarily a place to go. It's a different way to think and a different way that doctors approach things. Dr. Hyman's quote, as I talked about, the guidelines are there only to treat full-blown diabetes. And the focus for the treatment of diabetes today is to treat the blood sugar. But some of the most damaging parts to your body happens because of high insulin. You could have normal, these people that I see that have peripheral neuropathy in their feet, a lot of them will have normal blood sugar, but their insulin has been up real high trying to keep that blood sugar normal. So the natural approach, what I'm talking about, is to focus on the level of insulin. If you can keep your insulin from going high, your blood sugar is going to be fine. But you can suppress your blood sugar kind of artificially with drugs, and your insulin will still be high. And some of the drugs actually increase your insulin. And high insulin is causing a lot of the damage to the body. There are some myths. I'll just toss these out. Diabetes is genetic. Well, you heard my story earlier. I'm highly predisposed to diabetes. My genes are constructed such that if I eat simple carbohydrates, they convert it to glucose like that. Whereas somebody else that doesn't have my same genetic makeup can eat the same or more carbohydrates and theirs doesn't respond. That's the genetic given. But it doesn't mean that since I have such a strong genetic history, and incidentally I forgot that I have 3 sisters, 2 of them had diabetes. I have a strong history, but I'm determined I'm not going to have diabetes. 10% of the risk of diabetes, or really any, and it's being shown in any genetic disease now, only if you had a genetic predisposition, it's like the maximum effect on you is 10%. The other 90% is the environment. It's what your environment is going to tell those genes that you have, what it's going to tell them to do. The first thing about your environment that can move you in the wrong direction is what you eat. Drugs, pollutants, heavy toxicity, psychological stress, inflammation, and by inflammation I'm talking about the systemic inflammation inside your body, free radical production, oxidative stress, infection, gut bacteria, low vitamin, mineral, and nutrient status. All of these can turn on a diabetic gene. And an example of that was the Pima Indians, which are Native Americans, were not known to have diabetes at all. And then the modern diet was introduced to them They started eating sugar and soda and white flour and processed foods. And they became the second most obese population in the world. And 80% of the Pima Indians have diabetes by 30 years old. Their life expectancy is 46. Type 2 diabetes has been diagnosed in 3 to 4-year-olds of theirs. All this changed within 1 or 2 generations. So they had the gene structure that could lead them to become a diabetic, but until they started eating kind of America's modern day food, they were fine. This is revolutionary, and when I learned this, it was just totally different. And you think, I mean, I've thought about food, what you're supposed to eat. I mean, there's quality of food, there's good, there's bad, you know, good, better, best. And food is food. I mean, you know, when I was younger, I just wanted to keep my stomach from growling. And a lot of people strive for the flavor of food, or particularly flavors. And I mean, food was just something you put in your system. You know you need it. You know it's a fuel. But what it does, what we're realizing, is that the nutrients in the food, certain nutrients, talk to your genes. And they can switch certain genes on and certain genes off. So food is a communicator. It's more than just filling your stomach. That's what happened to these Pima Indians. They were eating food that told that diabetic gene, turn on. And the higher the insulin is in the body, what insulin does is it's not only transporting glucose, but any excess calories you eat, it tells to put in storage, which is fat. So insulin drives your fat gain. And insulin fat gain is like a male fat gain, is a beer belly. It's right here in front on men and women. Next myth is diabetes is not reversible. Just last year, about a year ago, there was a study that came out that where they took a group and they reversed diabetes, not just the blood sugar, but they watched the insulin. They reversed diabetes in 1 week. Dr. Hyman's book, just to talk a little more about it, he has a plan, and he's really good at trying, you know, not just talking about things. I mean, he's got a website, and there's actually a program, and his program can help. I mean, his goal is to help reverse people who have diabetes, help reverse that in 8 weeks. And he has an online support and a lot of involvement with that. The next myth is prediabetes or insulin resistance is not a problem. You know, just like I mentioned, I have patients that come in and their doctor has said, well, you're pre-diabetic. You know, we'll check it 6 months. Well, these folks have all those risks that I mentioned earlier about higher stroke and just all the bad, you know, these bad things. 2/3 of in the emergency room, 2/3 of the people that show up with heart attacks have insulin resistance. The peripheral neuropathy occurs in this group earlier, and that's just starting to be recognized, and it's even starting, you know, we do know that high glucose can damage nerves, but now it's being shown that high insulin can damage nerves. So those people who have a normal glucose, but yet their insulin is high, can wind up with permanent peripheral neuropathy before their diagnosis with diabetes. There's myth, once you start on insulin, you can't go back. Just as, I mean, the folks that did the study to reverse diabetes have gotten people off, and Dr. Hyman, you know, will illustrate that too. You know, even though you're on insulin, doesn't mean you can't get off of it. Now, I should have started at the beginning. When I say diabetes, I'm talking about type 2 diabetes. Type 1 diabetes, your body doesn't produce any insulin or not enough at all because the pancreas has been attacked by a disease. And those folks have to have insulin. But the same management of the metabolism of the body works for them as far as low carb is better than high carb. Lower insulin, high insulin causes the same damage in their bodies as in type 2. Another myth is lowering blood sugar with medication prevents death and heart attacks in diabetes. So, a lot of diabetics are being well managed because they're watching their blood glucose, and therefore the medications that are helping to do that is going to reduce their risk theoretically. A lot of people think it's going to reduce their risk to have these bad things that can happen to diabetics. Well, there was a ACORD study in 2008 published in the New England Journal of Medicine where they compared the regular therapy to manage glucose levels, regular therapy meaning drugs, certain ones that were successful. And they wanted to see if they got increased the dosage or added more drugs to manage the glucose. If they drive the glucose down, would they get better? And that would be a sensible logic to pursue if glucose is the main culprit for damaging the body. But what happened was the National Institute of Health had to stop the study before it was over because too many people were dying from heart attacks. And the ones that were dying more often were the ones with the intensive therapy to drive their glucose down. So that proved that it wasn't the glucose level in the blood that was causing the heart attacks, because they were driving it down by increasing insulin. It was the high insulin that was the culprit. Then the drug Avandia just by itself caused 47,000 deaths in the first 11 years it was used. The Journal of American Medical Association had another study where they looked at 5 different studies using statin drugs. Those are the Lipitor, cholesterol-lowering drugs. And this is just kind of recently coming to light that they didn't reduce the risk of heart attack if you hadn't had one. They did if you had already had a heart attack and you take statin drugs, it will reduce your risk of a second one slightly. But what it did was it increased the risk of diabetes. Statins and beta blockers, beta blockers are used for high blood pressure, can increase your insulin. That's just a side effect. So what do? If there's these kind of loopholes and these problems, dang if you do, dang if you don't. Well, the steps to wellness, the natural way to treat this disorder is to give your body what it needs. First, you should be taking a good multiple vitamin and mineral. And I mean a good one, because there's a lot of not so good ones out there. So you need to give your body the nutrients that it needs. It's management of glucose. It's like metabolism is the word that we use to talk about how that's working. And some of my patients don't understand what metabolism is, so I just tell them, just think of it as wherever you see the word metabolism, just think of your body's engine. That's just talking about how your engine works. And if you don't have the right nutrients, if you're low in zinc or low in chromium, your body's engine is not going to handle carbohydrates as well as if you had, the amount that you need. So just like oil and water and gasoline in your engine, you got to have all those things there for it to run well. The big one is to eliminate simple carbohydrates in your diet. And there's carbohydrates are broken into two categories, simple and complex. And what defines as to what category they fit into is how they make your glucose respond. If they make it shoot up, it's a simple carbohydrate. If it's slower in responding, it's a complex carbohydrate. The slower a food converts to glucose, the better. You know, you don't want sharp curves going up and down. What you want is just an easy wavy line like this. And one of the remarkable things about the body is we're talking about glucose, and it's a fuel for your whole body, including your brain. And your body is so magnificent at trying to regulate it. If you had a tablespoon in a person, a tablespoon of glucose in their body could be too much and could cause a coma. A teaspoon could be too little. That's how narrow a range your body's challenge is to regulate it. I think it's amazing. Real popular athletes are turning to it. A whole lot of them call it a diet, but it's just a way of eating. It's called the paleo diet, after the Paleolithic period. That was the period that the caveman existed. And the paleo diet is no grains at all, because the caveman was a hunter-gatherer, and there was no agriculture at that time. And what he ate, what the paleo diet is no grains. It's proteins, meat, fish, chicken, and vegetables and fruits, which if we all did, we'd be great. A low-carb, high-protein balance. The guideline that I give my patients, as far as, just they say, well, what do I need to eat? And I like to give guidelines and not specifics. I'm just not a detailed person. Not counting grams doesn't work for me, so it's hard for me to ask somebody else to do that. What I just tell them is, on your plate,